Bismillahirrahmanirrahim. I'm participating in the third International Brain and Biomedics Conference. The title of my article was Anti-Arthritic and Toxicological Evaluation of Ethanolic Extract of Alternanthera betsigiana in Rats. So it is presented by Manan. My affiliation is Department of Pharmacology, Faculty of Pharmaceutical Sciences, Government College University, Faisalabad. Abstract is in many developing countries, medicinal plants have long been used for therapeutic purposes due to their low cost and toxicity. This study evaluated the safety and anti-arthritic potential of Alternanthera pedzigiana ethanolic extract. Acute oral toxicity was tested in safety evaluation also. Par diameter, hematological, and biochemical variables were quantified. Alternanthera bedzigiana ethanol extract decreased the part diameter with the restoration of hematological and biochemical changes. SOD and CAT levels were increased while MD and no TNF alpha and IL-6 levels in the arthritic rats were decreased. The traditional use of herbal medicines was common before the evolution of synthetic and semi-synthetic medicines and remains common. Rheumatoid arthritis is a systematic inflammatory autoimmune disease with no cure. It is marked by the consistent swelling of the synovial joints, which give rise to bone and cartilage erosion. Alternanthera betzicana belongs to the Amaranthaceae family. Amaranthaceae include nearly 65 genera and more than 900 species. It is also called border plant, the red calico Baptist plant. Locally in Pakistan, it is also called Nanthara. It possesses wound healing, soft laxative, blood purifying, galactagogue, and fever reducing properties. The study was carried out to assess the acute toxicity and anti-arthritic activity of Alternanthera betzicana using formaldehyde-induced arthritic model. Material methods collection. The plant was collected from Punjab in March 2019. Extract was prepared using microwave extraction technology. Non-pregnant female visitor rats aged 9 to 10 weeks were randomly taken. Rats were housed under standard conditions for 5 days to acclimatize them. Then acute oral toxicity study was performed. The rats were housed. The limit test dose of 2000 milligram per kg was given. After 14 days, rats were again weighted and blood was accumulated. The serum was isolated for carrying out biochemical and hematological analysis. Vital organs were removed and weighed. Then hematological and biochemical analysis was performed. Blood from both treated and vehicle controlled rat was collected in EDTA containing tubes. Then hemoglobin, RBCs, white blood cell count, cholesterol, triglyceride, VLDL, bilirubin, ALT and AST were measured. Then histopathological analysis was carried out using photomicroscope. Then anti-arthritic potential was assessed by formaldehyde-induced arthritis. Rats were divided into 5 groups of 5 rats each. Group 1, rats were injected with formaldehyde solution on the first and third day of experiment. Group 2 were injected with formaldehyde solution as in group 1. Then diclofenac sodium treated group. Rats were injected with formaldehyde solution as in group 1 and administered diclofenac sodium daily at a dose of 10 mg per kg for 10 days. 2% weight by volume formaldehyde solution on days 1 and 3 of the experiment. Arthritis was assessed by measuring mean increase in palm diameter by vernier caliper for 10 days. Then arthritis evaluations by hematological and biochemical parameters was carried out. The rats were slaughtered under chloroform anesthesia. The hematological factors, red blood cells, hemoglobin, white blood cells, erythrocyte sedimentation rate, aspartate aminotransferase level, creatinine, rheumatoid factor were determined. Then enzyme-linked immunosorbent assay was performed and oxidative stress markers were measured. Statistical analysis was presented, and the results were presented as mean plus minus standard deviation, and the statistical significance was analyzed by two-way ANOVA. Results showed that oral acute toxicity study was performed and respiratory rate was increased in extract treated rat for 1.5 hours. Animals were observed for 14 days. Body weight of vehicle control and extract treated rats were increased. Slight behavioral changes were recorded. Organ to body weight index was also determined and it showed no remarkable change among the groups. No lesions were observed on isolated organs such as liver, heart, or kidney. Then, effect of extract was measured on hematological and biochemical variables. It was observed that no significant change was observed for hemoglobin, red blood cells, ESR, neutrophils, monocytes, and lymphocytes. The platelet count was raised significantly. The level of aspartate aminotransferase, ALT protein, globulin, AG ratio were altered non-significantly. Non-significant variation were also observed for urea, blood urea nitrogen, and total bilirubin levels. Histological assessment was performed and it showed no structural changes in the liver, kidney, and heart tissues of extract-treated rats. Effects of Alternanthera bedzigiana ethanolic extract in formaldehyde-induced arthritis were observed. Formaldehyde injection showed a swelling of left hind paw on the first and third day. The increase in paw inflammation was recorded for 4 days and then it was found attenuating in treated rats in a concentration dependent manner. Diclofenac sodium rats showed 70.80% decrease in paw diameter. Then effect on the hematological and biochemical variables. Hematological and biochemical variables such as evaluation in ALP, AST, ALT levels were recorded. Furthermore, ALP, ALT, AST levels noticeably increased in disease-controlled rats. Additionally, increased serum values of CRP, RF were observed in disease-controlled animals. Treatment with the diclofenac sodium significantly decreased CRP and RF levels in treated groups. Then effect on the serum levels of TNF-alpha and IL-6. An elevated level of TNF-alpha and IL-6 was noticed in disease-controlled rats, although the elevation was significantly decreased by administration of extract at 1000 mg per kg, 5000 mg per kg, and then diclofenac sodium dose. Then the effect of extract on oxidative stress markers. The outcomes of oxidative stress exhibited that SOD and CAT concentration in serum were significantly reduced in disease control animals. However, uh, diclofenac sodium and plant extract increased the serum concentration of SOD and CAT in adjuvant injected groups. MDA level and NO concentration in serum were also remarkably elevated in disease control animals. Discussion. Plant have been utilized for the treatment of various disorders for a very long time. The metabolic reactions initiated by toxic substances mostly target the heart, kidney, and liver. Histopathological assessment is a benchmark for assessing pathological signs exhibited in simultaneously study in which the architecture of organs of treated rats was normal. RS are active and can harm cell structures such as protein, nucleic acid, lipids, and carbohydrates. This study concluded that Alternanthera bedzigiana ethanolic extract has low toxicity without any morbidity and mortality. Outcomes also propose that oral administration of Alternanthera bedzigiana extract in arthritic animals remarkably decreased paw thickness and inhibited abnormal changes in hematological and biochemical variables. Alternanthera bedzigiana may be used as an optional therapy for the treatment of rheumatoid arthritis. These are the references. This is my paper which is published. Thank you so much.